Welcome back, guys. We're going to talk about coronavirus in this section. We'll do 3 questions. We'll talk about virology, how coronavirus causes common cold. We'll talk about SARS-CoV-1, which causes severe acute respiratory distress syndrome. Then we'll talk about Middle East respiratory syndrome, MERS. So this video is recorded on August 1st, 2021. Because we don't have up-to-date information, so I have read the latest article. I will try to give you the information which we have right now. Okay, so we'll start with a question. So question number 204: which of the following statement is true regarding coronaviruses? Option A: all human coronaviruses have animal origin. Option B: 7 coronavirus serotypes have been associated with disease in human. Option C: COVID-19, which is a disease caused by SARS-CoV-2, is clinically milder disease as compared to MERS or SARS in terms of severity and case fatality rate. Option number D: all of the above. So here the right answer is option D. All of the above are true. We're going to talk about all these 3 options in next slide. Okay, so let's talk about introduction. We have 7 coronaviruses which are known to cause infection in human. They belong to alpha and beta genus. We'll talk about that. 4 of these coronavirus causes mild respiratory illness, common cold. The 3 remaining coronaviruses are viruses that cause severe respiratory distress syndrome. It can cause pneumonia and even death. Those 3 viruses are: number 1 is SARS-CoV-1, which caused severe acute respiratory syndrome in 2002 to 2003 in China. Number 2 is MERS-CoV, Middle East respiratory distress syndrome. And the third is SARS-CoV-2, which causes COVID-19, coronavirus disease 2019, which we are dealing with right now. So we have 3 viruses which cause severe respiratory syndrome, even death, okay? And 4 viruses which can cause common cold. Now let's talk about classification of coronavirus in this section. So if you see, on coronavirus belong to nidoviruses order, and they are classified in the family of Coronaviridae, okay? And subfamily is Coronaviridae. Coronaviridae has 4 genus: alpha, beta, delta, and gamma. Now most of the human coronaviruses are caused by alpha and beta. Beta coronaviruses, now SARS-CoV-1, SARS-CoV-2, and MERS-CoV, they belong to beta coronaviruses, okay? Let's go to next slide and do another question. Question number 205. Historically, coronaviruses are known for causing the common cold in immunocompetent individuals. Is this statement true or false? This statement is true. Let's go to next slide and talk about common cold. Now, there are 4 coronaviruses which causes common cold. They are 229E, which was discovered in 1962. Then OC43, which was discovered in 65. NL63, which was discovered in 2004 in Hong Kong. And HKU1, which was discovered in 2004. Now, these 4 coronaviruses belong to alpha coronavirus and beta coronaviruses, and they cause common cold. Let's talk few points regarding common cold, okay? Approximately 15% of common cold are attributable to coronaviruses. Rhinoviruses and adenoviruses, they can cause up to 40%, 30 to 50% of common cold. Common cold respiratory infection caused by coronaviruses occur primarily in the winter. We are still learning about COVID-19 infection, whether it is whether temperature has any relationship with severity. But common cold is typically seen in the winter caused by alpha coronaviruses and beta coronaviruses. Common cold coronavirus infection are diagnosed clinically. We don't do testing. Patients usually get better if they are immunocompetent, okay? And case fatality rate is very low. Most of the immunocompetent patients, they recover from common cold infection caused by coronaviruses, and they belong to alpha coronavirus and beta coronavirus. So let's go to next slide and talk about SARS-CoV-1. Now, SARS-CoV-1 caused severe acute respiratory syndrome. This virus caused infection between November 2002 to February 2003 in China. Total of 792 cases were reported. The virus spread rapidly from southern China to Hong Kong to Vietnam to Thailand, Singapore, and then to Europe and US. What happened? There was one doctor who was treating a patient with SARS, and he traveled from South China to Hong Kong. He attended a wedding, and from there the virus spread globally, okay? Now, what happened when the outbreak was controlled? It resulted in 8,096 cases. Out of that, 774 died, and the case fatality rate was 9 to 12%. So SARS-CoV-1 case fatality rate was much higher than COVID-19 infection, okay? Most illnesses occur in adult, and no fatal cases were reported among children. So let's go to next slide and talk about the spread of SARS-CoV-1. Now, SARS-CoV-1 is the natural host of SARS-CoV-1 is a horseshoe bat, as shown in this picture. What happened? The SARS-CoV-1 mutate from bat to civet cats. From civet cats were intermediate host, okay? Now from civet cat, the virus was transmitted to human, and that caused severe acute respiratory syndrome. Now, so SARS, like COVID-1, was isolated from bat. It shared almost 88 to 92% genomic identity to COVID from human or civet cat. So the virus which was isolated from human and which was isolated from civet cat, the genomic sequence of that virus was identical to horseshoe bat, identical to coronavirus found in horseshoe bat, okay? Now, horseshoe bat, they are natural host, okay? Now, what Chinese government did in 2004, they killed all the civet cat, as shown in this picture, and these cats were used as a culinary delicacy in China. So they got rid of all intermediate host and they controlled the epidemic. And one point I want to make here is, before I go to next slide, is coronavirus is a zoonotic disease. It needs a living host to multiply. Coronaviruses are naturally found in bats. From there, they can mutate and travel to intermediate hosts, typically mammals. From there, it can travel to human, okay? So let's go to next slide. The big question is, why SARS, which was caused by SARS-CoV-1, disappeared in 2003? We were able to control it in an effective manner, okay? So there are a couple of points. First point is, SARS-CoV-1, the highest viral load were detected in the upper respiratory tract in the second week of illness when patients were really sick, okay? Which explain these patients were having, this explained that the patients were not contagious in the first week of illness when in their basically in asymptomatic phase or pre-symptomatic phase. They were more contagious when in the second week when they were already in the hospital, okay? Second point, people who got SARS-CoV-1, they got very sick, very fast, easily identified, easy to track, readily quarantined, and their contact were also readily identified and quarantined. Okay. The last point, there was no extra spread from people without symptoms, and as a bonus, SARS took long time to incubate before it became contagious. Now, COVID-19 patients who have SARS-CoV-2, which cause COVID-19 infection, 10 to 45% patient can have asymptomatic infection, and during that period, these patients are contagious. They can have significant viral load. But SARS-CoV-1 patient, they were not contagious during the first week of illness. During the second week of illness, when they were already in the hospital, you can isolate them, you can quarantine them, you can trace their contact, and you can quarantine them too. That was the main reason we were able to control SARS-CoV-1 infection in 2003. And another point is, Chinese government got rid of civet cat, which were intermediate host. We still don't know the intermediate host of SARS-CoV-2. Okay. So let's go to next slide and talk about this graph. So this graph, on the y-axis, you see you have SARS-CoV-2 viral load, which causes COVID-19 infection. And on x-axis, you have a time. So here the time is from 0 days to 14 days, and then you have -5 days before patient becomes symptomatic. So I'm going to show you, if you see this graph, the viral genome, okay, highest, so in this red box, you see highest infectiousness potential just before or within the first days of symptom of onset. So patients who have COVID-19 infection, they are infectious even during, even before they become symptomatic, during asymptomatic phase. Now let's see SARS-CoV-2. So this black graph, if you see SARS-CoV-1, high viral load when patient is very, very sick during the second week of the sickness, when they are already in the hospital. So you can, that's why we were able to control SARS-CoV-1 better as compared to we're still struggling with SARS-CoV-2. Okay. We're going to discuss this graph in detail when I will talk about SARS-CoV-2 transmission in next section. Okay. So let's go to next slide and talk about Middle East Respiratory Syndrome, which caused by coronavirus MERS-CoV. Okay. Now MERS-CoV caused severe respiratory illness. It emerged in 2012, approximately 10 years after SARS-CoV-1. A total of 2,574 cases were confirmed, including 886 associated deaths. So look here, case fatality rate is pretty high. If you divide 886 by 2,500, so your case fatality rate is approximately 34%. So MERS and SARS-CoV-1 both have higher case fatality rate as compared to SARS-CoV-2. So MERS leads to severe pneumonia and acute respiratory distress syndrome, and even some patients have acute kidney injury. Okay. So let's go to next slide and talk about the transmission of MERS. So now the MERS virus is naturally found in bats. The RNA fragment obtained by PCR from bat stool shared 100% identity with MERS-CoV from an infected case living in the same area. So what they did in Middle East, patient who had MERS-CoV infection, they took the patient virus from the patient, and they also found that the bat which are found naturally in that area, they also have coronavirus. So the sequence was matching almost 100%. So, and the intermediate host here is a camel, okay, and human were accidental host. Now let's go to next slide and talk about question number 206. SARS-CoV-2, which causes COVID-19 infection, share approximately 79% genomic homology with SARS-CoV-1, while only about 50% similarity with MERS-CoV. Okay, is this statement true or false? This statement is true. So let's go to next slide and talk about this statement. So in this purple, you see you have a SARS-CoV-1. This virus, they share 80% homology with SARS-CoV-2. The blue one is MERS-CoV. This share 50% genetic similarity with SARS-CoV-2. Okay, so that statement was true. Okay, so I'm gonna stop here and we will talk about SARS-CoV-2 transmission and prevention in next section. We will also discuss epidemiology, and we will also talk about how to use mask and how to use hand wash. Okay, so we're going to stop it here. Thank you.